Everyone, yes, my microphone's on. I can hear my voice booming around. Welcome back after the excellent cake and coffee. I hope you're all feeling refreshed. It's slightly an after lunch session, so I've been told by my panelists that they're going to inject some energy into this. Mark's promised some jokes.
A joke.
A joke. And I think some piss taking as well. So we're looking forward to that. So we've been talking a lot about, obviously, rapid evaluation. That's the conference. But there is obviously an end to all these, an end we've all got in mind to these rapid evaluations, which is affecting change. So how do the results of our evaluation actually lead to change on the ground? That's all what we all want to see. We're not just doing evaluations for evaluation reports. So that's what this session is about. So I've got three excellent panelists. We're going to, first of all, Annette's going to talk to us really about a bit of a conceptual framework. I think that's the way you described it, Annette. Like helping frame this, thinking about knowledge mobilisation, getting evidence and analysis into practice. And Rich's going to talk to us a view from someone who's actually working in a trust as, in charge of programmes and things. And then Mark is going to give us the view from the shop floor. That's what someone told me you're going to be doing, as a kind of someone who's working as an analyst in the NHS. So that's the format. And so I'll pass over to Annette to start with.
Thank you. It's great to be here. It's been a fantastic conversation today, and I hope with what I'm going to say you'll see lots of parallels to issues that speakers and questions have raised throughout the day. So I started out as a policy evaluator some years ago, and in the end I left that role because I got very disillusioned about the use of evaluation, and I went to work in the Department of Health and Social Care to have a look from the other side to see what happened to the work that we were doing. And I have to say what I found more was kind of poor systems, stuff lost in filing cabinets, not really accessible, than a kind of intentional unwillingness to use evaluation. And so I came away from that very, very interested in kind of how we use evaluation for policy purposes, how we can do that better. And that's led me to the role that I've just started at King's, where I am looking after the policy research unit for the health and social care workforce, which, if we don't already, will be connecting to the work that many of you do, and I look forward to those connections in the future. But I'm also particularly interested in the role of a policy research unit as one of the mechanisms to provide this more rapid evaluation support that, in theory, is useful to government. So I said I'd, in a nutshell, say what I thought knowledge mobilisation was about. And I'd written down three things you won't be surprised about. One is about messaging, the other one's about relationships, and the third one is about systems change. And these are the three core things we talk about in knowledge mobilisation. We talk about getting our messages out more clearly and more articulately, about building the kind of relationships, networks and connections needed for the evaluation work we do to be useful, and making adjustments to the systems, so science systems in government, systems in delivery organisations, systems in universities and other evaluation providers, to work as hard as we can for that evidence to be used. One of the main barriers that's identified is an issue of time, and so the rapid element we're looking at today is so critical. But as we were talking in the previous session, I was reminded of other things I say when I'm talking about knowledge mobilisation, and they are about ways of thinking that I think many of you have articulated over the day around serendipity that was mentioned in the last session I was in, about kind of sensitivity, about connectivity, and probably the most important one is about humility, and that's about knowledge mobilisation and supporting the use of evidence for policy, being about understanding what we don't know as well as what we bring from the work that we do in evaluation. But it is critical, this issue of timing, because one of the main barriers that all surveys of evaluation users bring up is that research and evaluation are too slow. They are out of step with the rapidity of delivery agendas. And so how can we do that work faster? And that has been really interesting, hearing people talk about how we might, do that faster and faster and faster. We've heard lots of different words for kind of upping the game with our rapidity. One challenge I would put out, though, is I think we're very quick always to do new pieces of evaluation, and in fact this came up in the last session, that we could do a lot more to use what we have already from existing evaluative work. And this is what my colleague Ray Pawson initiated back in maybe I was going to date this to the birth of my second child, so it came around about 2006, and he did a book called Realist Synthesis, taking his thinking from realist evaluation and applying that to synthesis. And what he was arguing was how we use better the cumulative bodies of knowledge we have, how we mobilise that to help us with these thorny evaluation questions, particularly around shared mechanisms, so a mechanism that we're using in different contexts. The one I'm coming across a lot at the moment is the use of funds for apprenticeships, funds for what is this mechanism of funds all about, how have we used them before, what can we learn from that? So I think maybe we miss a trick in that reuse of what we know already. And linked to that, how we as evaluators can help, which was raised by Ami, I think, in the first session, around how we bring our evaluation capacity to bear to help actually with that important issue of using data that sits within organisations that we could really help with. Just to add to that, I think we could do more work with the partnerships that we do. And we've talked a lot about collaboration and connecting, but knowledge mobilisation talks a lot about building long-term and sustained partnerships to underpin the evaluative work that we do. And what that argues is that we are therefore in a really good place to take on and do trusted pieces of work and to exploit windows of opportunity when they arise, because we're the people that people come to. And many of you will be those people for others in policy roles. And just a couple more things. One is around independence. So I think a concern people have about working in closer partnership is about their independence as evaluators. And Pete Bauer at Manchester has written a really interesting piece in a blog around actually we can work really closely, as we've talked in many sessions, engage right from the start, but sometimes recognise we need periods of distance. What he calls it is like driving into a tunnel for a while we're doing bits of work that we feel we need a bit of distance for, and we can absolutely work that into our ways of thinking. But a lot of knowledge mobilisation is about relationships, and it's about engagement, and it's about being more creative. And if there's one thing I always come back to knowledge mobilisation about, it helps us get away from being a paper and bureaucratic way of thinking. It's about being more co-creative. It's about using different mechanisms to engage with people. And so if anyone is interested in knowledge mobilisation as a field, it has loads of stuff. The knowledge mobilisation national meeting's going on today, and they're posting online pictures of scrolls that they've hidden all over the conference venue. They're just very different in how they think, and there's something we can take to that, because I think we are a bit comfortable in our kind of very bureaucratic relationships with policy and practice. I'll stop there.
Thank you very much, Annette. Lots of food for thought there, lots of things for people to jump off on later. Just before I move to Richard, there was something I meant to say at the beginning, which is I think someone has lost a phone or left a phone. So just to let you know that if you have, I've got it on this table here. Either come up now if you need it now, or maybe you could get it from me or from the table at the end. Sorry for that brief commercial break.
That's okay. Thank you. So following the commercial break, I'm Richard. It's good to have a chance to share some thoughts at the end of what's been, I think, a really, really interesting day. And some of what I had intended to say at the start of the day, I think, picks up some themes that have been shared as we've gone along. In my day job, I'm the Chief Executive of Birmingham Community Healthcare NHS Foundation Trust, which is a bit of a mouthful, but it's one of the largest specialist community health providers in the NHS, serving Birmingham and parts of the wider West Midlands with all of the challenges of kind of deprivation and diversity that throws up in the communities we work with. We're also leading an integrated care system-wide primary and community care partnership designed to bring to life integrated models of care in neighbourhoods and localities. And that's partly where my interest in this comes from, because we've been looking hard for and thinking carefully about how we might help add to the body of knowledge about what works in that space. And whilst, if you look at the complicated end of medicine, there are randomised controlled trials in abundance about some of the most high-tech interventions we deploy. Finding the evidence-based for integrated multidisciplinary teams improving care for people at that very local level is perhaps harder than you might think, or maybe not harder than you might think as folk working in the field. There are 4 things I wanted to offer from that perspective. The first, I guess, is to say that any evidence is better than no evidence. I've read lots of papers which conclude, the evidence is very limited, or it's very low value, or, well, okay, I get that, but get it to me, tell me what it says, help me understand its limitations, and we'll make a better decision for having had it, even if the conclusion still needs to be, together we need to do more to build better evidence. So don't let the fact that in no space have we got perfect kind of knowledge prevent us doing something better than we could otherwise have done. I'm a historian by kind of academic training, and of course your evidence is inevitably limited, and the further back you go, the more limited it is, but it doesn't stop us trying to use the evidence we've got to build the best picture we can. So any evidence is better than no evidence from my point of view. There's something for me that's been touched on a few times about kind of how rapid is rapid, and I play a role in BRACE, at the Birmingham-based Rapid Evaluation Centre, and I think my main role is periodically to say, when I say rapid, I mean the end of the week or possibly Tuesday. When you say rapid, you seem to mean 6 months. Hence, now that's a cheap shot at my colleagues in the evaluation world, but it's the trade-off, isn't it? If we need something by next Tuesday, then what we'll get is this. If we can wait longer, we'll get this. If we can wait longer still, we'll get this. And I just think the more direct we can all be together about the trade-off, the easier it is to judge what we can expect at what stage and how to fit that into the decision-making timetable, which often doesn't wait. And I guess that would lead me to my third point, which is about kind of something about seizing the moment, and if we're interested in putting a stronger evidence base and a stronger evaluative way of thinking into what we do, then there's a bit about go where the energy is. There's an enormous amount of national focus on productivity at the moment. That's a broad enough term to be bent to many different kinds of pieces of work. There's a lot of interest in integrated care. There's a lot of interest in the relationship between mental and physical health and its impact on work and worklessness, and go for the things where folk are trying to wrestle with it in order to get the attention that the work we're trying to do needs, would be my kind of third bit. So sort of seize the moment, follow the energy. And my fourth point would be something about where this is often most effective from my point of view, is where there's a chance to build some kind of longer term relationship between a unit involved in rapid evaluation and an organisation delivering services, or a team of people thinking about policy, and someone has to work out how to pay for that, and we've not talked a lot today about who pays, but it is an important question. But where there can be some local relationship, the health service in a particular place and its academic institutions, or its or organisations involved in this, you can get in earlier, you can share ideas sooner, you can build things up as you go, rather than a more episodic model in which someone decides they want a rapid evaluation of something and they stick out a commission, and someone they've never met before arrives and tries to meet their needs. So I would kind of strongly encourage all of us, I guess, to think about how we might build those local institutional partnerships that give us a foundation to take things forward from. So, thank you.
Thank you very much. Some common themes there, I think, between the two of you. You mentioned, some of the same things, but in kind of slightly different ways. So now I'm going to turn to Mark.
Okay, thanks, Charles. Thank you for inviting me. You've had a lovely day. It's really nice to finish it in Charles's office at the Health Foundation. So I'm Chief Analytical Officer for an ICB, NHS Kent and Medway, and I'm the Chief Analytical Officer for the biggest acute on the patch as well, which is East Kent Hospitals. And I've kind of deliberately kept the role across both, because you get that adrenaline of working in a trust, of needing to know something by Tuesday, but you also have a little bit of time to try and get public health in the room and, be slightly more strategic as well. So it's kind of quite a nice balance. And I also chair a national a group of chief analytical officers like myself as well, which has kind of grown really quickly over the last year or so. So if that's of interest to anyone, just get involved through the AFA website. And it reminded me that I sort of met Charles on occasion. The second time we met, the Health Foundation had sponsored us to write a book which sort of linked to what Fraser was talking about this morning about data and decision makers, which is so important. And it was a really, really good session this morning. And we had a session, we were going to publish a book called something like Data and Decision Makers, How Not to Lose Your Job. And all I did was I kind of went off to a group of friends who are experts in the field to write a kind of, with respect to sort of Bluffer's Guide for Richard, with, you know, a chapter from Annette which says this is what evaluation means. Someone else would talk about this is why you'd use adjusted mortality data as opposed to crude more. So I got a load of experts to kind of write all these chapters, and I thought we'd write it in quite an interesting tone which might engage people. But the Health Foundation have a policy in their communications department which is that you cannot have swear word on every other line. And there was a really interesting meeting where Charles was really sympathetic and just went, we'll give you the money, you can have all of the money, but we just can't publish it. So we went and published it elsewhere. And I'll send you the link on Twitter. I think I'm here to give the kind of shop floor perspective. And I think, if I may, I'll just give you a couple of quick examples of the types of things that we're doing. And I've not been in the NHS. Usually people go, I've been in the NHS my whole life. I haven't. I've been for about 13 or 14 years now. I worked at Dr. Foster before that, had worked in academia and management consultancy before that. But I think in the 13 years since I joined the Trust, I've been involved in one evaluation. So I'll let that moment just pause. And we actually wrote up a proper evaluation, and I think it was a good evaluation, and it proved benefit, and it saved money. But the fact that we actually wrote it up, we won a whole load of awards, because people just don't do evaluation very often, and if they do, they don't write it up. And in that kind of pace of working in a trust, you just don't see the evaluation very often. So that was kind of interesting. During COVID, you literally couldn't wait till Tuesday, because we were streaming, is it going to be red and blue streams of patients. We realised that if NHS Digital would release the COVID test that Richard had done yesterday, when he appeared in my trust at the beginning of COVID, and it took me over a day to do it, to get the COVID result back, that's quite a long time. That's plenty of time for him to infect Annette and Charles. So I thought, hang on, let's just phone NHS Digital. We could receive that data in real time, stand up a system, publish it in ED. I've got software developers ready to go, so that as he walked through the door, we could go left for you, left for you, Richard, right for you, Charles. And it escalated into this horrendous argument on Twitter and through the HSJ, where people who are much, much more senior than me were saying, you need to wind your neck in now because you're embarrassing NHS Digital. But you then get someone much, much more senior phoning you saying, what you're doing is fantastic, but we can't come out and criticise NHS Digital. And that we evaluated actually relatively quickly, and we proved it and we published it online. And I have an issue with a kind of, I think you call it knowledge mobilisation, which is a lovely academic phrase. And often, and we're awful in NHS England at doing, we then hide it all. So we create NHS Futures and make you have to have a password to get into it, when you could just publish it on the internet. There's a thing called the internet, and there's a thing called Google. You'll get to it. We've figured all this stuff out already. There's Facebook and Twitter, and there are search mechanisms, but we've got this little bit of evidence and we hide it in an academic journal that no one ever looks at. So that was a couple of examples. In COVID, as you'll remember, in the first few weeks, the headline every Sunday was the risk of domestic abuse during lockdown. So we were approached by the police who, and I'll speak in sort of crude language, have got a file of men who hit women. I've got a file of women who get hit by men. And the IG of that, as you would imagine, is relatively sensitive. But because of coping notices and what was going on with COVID, we were allowed to really quickly make an ethical, moral argument to link those two data sets together and evaluate the effectiveness of building a statistical model to predict when domestic abuse might occur. Because apparently, on average, a woman will get hit 6 times before she appears at ED. So if we can bring that number down, obviously to 0, but intervene much more quickly. And that sort of rapid stuff we really learned during COVID, much more. The pace of it, as awful as everything was, the pace of it was really refreshing, because we were able to just get through IG conversations that probably, tied you up in knots for ages. Academics were working in a completely different way. It was really refreshing, and I don't think we should lose that as we kind of come out of COVID the other side. And one of the gripes I have a little bit, and I think today's been really interesting listening, because I've felt one of the messages has been, I'll pull out selfishly, academics saying we need to get on the pitch, because I feel like I've been saying for 10, get on the pitch. The HSNs were set up to have industry, academia and the NHS working much better together, creating better work in broad strokes, and until they all disappeared off into different things. We'll do a bit of evaluation, you do a bit. But in broad strokes, I work in Canterbury. There's 2 universities, University of Canterbury, Christchurch, on opposite sides of the road. I'm thinking, I've got loads and loads of data and loads of wicked problems. You've got a load of brain boxes and computers bigger than mine. There must be a marriage in there somewhere. And I didn't feel like there's something that pushes us in. People like you would kind of create that relationship, but it doesn't happen naturally. It kind of happens because of networks. And I think I still think that's a little bit of a failing. I've got a friend who's a professor at London Business School, and I sort of said, well, why don't you just join in a bit? I could give you some data, and you're an operational researcher, you could figure out ED for me. And he said, I've got literally no incentive. I've got 9 years to become the most famous person in my field in the world, and once I've done that, I can do whatever I like. Give me a call then. Which is, these are his words, not mine, and you're not disagreeing on that. So, I think it is beholden on you to get involved, and in that, sort of Chatham House rules, if you take, say, University of Kent and Canterbury Christchurch, traditional university, form Polytech, one of them's going, where's the PhD funding? Where's the publication model? Where's the money? The other one, Christchurch, is saying, I can give you someone at 600, I can give you Professor of AI, £600 a day, at 2 weeks' notice. That sounds great, actually, because Richard needs it done by next Wednesday. So somewhere in there, there's Tuesday, sorry, it was Tuesday. I'm late. So somewhere in there is a kind of more creative way of working, which kind of, and I'll kind of leave, there's a joke there which kind of works for GPs, but it sort of works for academics, which is, how do you hide a £10 note from an orthopaedic surgeon? You've probably heard this one. You put it in a book. How do you hide a £10 note from a GP? But it also works for an academic. You can't. So you're much more commercial than people give you credit for. And I think to one of your sort of closing comments, I think if we can figure out the incentives and just align everyone's incentives, that's quite a nice place to start, actually.
Thank you, Mark.
Okay.
Very good. And with the promised joke. So thank you.
Yeah.
So I'm going to open up to the floor in a minute, but just a couple of reflections building on what you've said. So throughout the conference, actually, I think there's been quite a lot of discussion around the role that we can all play as evaluators in helping the findings, the way in which we do evaluations and the findings land to have the biggest impact. But I'm also thinking about whether there are things, there are obviously some things which are outside of control. And to me, there's an element there in thinking about which kinds of things do we work on. So there was a thing about seizing the moment, seizing the right kinds of projects in terms of the things which are salient, so productivity, for example. But also, and this is drawing a bit on some of the experiences I've had, there's something about working with teams which have got the right kind of cultures. So, a team which just wants you to prove something is much harder to work with, because actually if you can't prove that, that won't go down very well. So I just wondered if you've got any thoughts on that, and what role as evaluators we might have, or the evaluation community might have in thinking about who we might work with. We're a scarce resource, that's why I'm saying this, not because I'm thinking we need to pick and choose. Well, we do, but only because we've got a scarce resource, and if we want to use it for the most impact, we probably should be thinking about where can we get the most value, including where is it most likely to affect change. So I just wondered if you've got any thoughts on what might be the kind of things that as evaluators we might look for in terms of and thinking about the kinds of things we might want to work on, particularly in terms of the kind of cultures of the teams?
The first thing I'd say is I think it's actually really hard to know what you choose that's going to be impactful, because policy changes all the time, relationships change, people move on. So although I think it's quite nice to have the idea of something you might think through around that, I think that process of spotting where to put your energy is really, really difficult.
Okay,
Yeah.
Thank you, Annette.
Yeah, I mean, a couple of quick thoughts. I mean, it speaks a little bit to the who's paying point, I think, in the sense if you're bringing some independence of funding, you've more choice over who you work for and who you don't. If you're dependent on people to commission you, then obviously there's a conversation to have when you're being commissioned. I think there's an interesting thing though about is the interest in changing policy or is the interest in changing delivery? Now, I probably would argue this from where I sit, leading an organisation that runs services. I think there's more chance to have more impact working there than there is trying to shift politics and government. Not least because you can sometimes shift policy without shifting anything beneath policy. And my apologies to those of you who work in that world in saying that. But and maybe the integrated care system is the helpful middle level, and maybe some of the AHSN ARC-style networks that go with it are the place to try to plug in, but I hope they might be.
Yeah, I mean, I think, and I was chatting to a colleague over lunch about what's odd in the NHS is that different people are not able to achieve the same thing everywhere. So some people might have a very forward-thinking view of information governance, for example, and in another part of the country it might be much more restrictive. So I think to answer your question, I would try and pick those people that are leading the way and pushing a bit. And the conversation we had specifically about IG was that if a few of us get together, there's sort of safety in numbers. So things like having a Chief Analytical Officers Network is useful because we can, literally design a logo and have a badge and become a kind of lobby group for taking important stands on issues that we think. So, and two big examples at the moment would be what's going to happen with the Federated Data Platform, what's going to happen with the secure data environment. If it's just Fraser or I mouthing off on Twitter, it's lost. But if you've got a group of people that come together and give a considered view, you can actually push things forward. So you might pick people who you think are, taking, ambitious approaches to data linkage or use of AI or whatever it is. I think you'd find naturally more interesting projects anyway, because I think there might be a risk in what you're doing as an evaluation community of going to places where you get a bit stuck and you get told, this is really political, you need to give me the right answer and so on. So it's you need to be able to spot the areas where you're going to be allowed to express yourself, by working with people who are brave and bold. And that might be a chief exec giving you fire cover or a group of professionals or whatever it is, I think.
Okay, thank you, Mark. Annette, you gave a good answer, but saying that it's quite difficult. I'm going to just try a different version of that question.
Okay, go on then.
Which is, so maybe it's not really about picking and choosing which ones, because you said that's quite difficult. And you did talk about some of these things, I think, when you gave your conceptual framework, but what should evaluators be doing to make it easier to land things? So Lucy earlier was talking about getting people to if there's a program that you think might not be working, getting them to articulate in their own words why that might not be working. And you made some really good points about the relationships being critical, but how do you think you can best work with people to try to get them into the space where they're learning and not defensive about things? Like, are there any kind of tips there?
Yeah, I think we've all touched on this idea of building these longer term, more kind of equal partnerships to underpin evaluation, so that you're entering into a kind of long-term relationship and you're understanding better each other's worlds and where you're coming from. So I just spent a few years in the Government Office for Science, and it was a real eye-opener into the kind of real pressures that, very different pressures that people experience within kind of analytical roles in government to the pressures I experienced within a university. So I think that's really important. There are other things that I mean, we did a big programme of work called Better Government for Older People for the Cabinet Office back in just short of 2000. And when we did that work, we got to the end and the Cabinet Office said to us, this is all very interesting, but how much does it cost to do all this? And no one had ever, we hadn't had a conversation about what kind of evaluation data they were going to need at the end of the day. We hadn't done any economic evaluation. We didn't have an economist. And we hadn't really had the conversation about, well, what is it you're going to need to know down the line? So a really important element of that. And that's not a half an hour discussion, is it? It's a really complex discussion. I do agree very much that I think theories of change are a really interesting way of helping people articulate what they think a policy is going to achieve. As many people have mentioned, it doesn't stop ridiculous things happening, but I think it does sometimes cut them off a bit short, and it does at least articulate what it is that's going on in people's heads in terms of what a policy might be trying to achieve and where it, how it thinks it's going to get there. So I think those are some of the tools that we have to help us do this kind of work.
Great, thank you very much. Okay, so I'm going to see if there are any questions from you guys now. So I think there's a roving mic, so if you want to put your hands up if you've got a question. Right, there's one at the back there. And should we take 3? If there are 3. If there are only 2, we'll take 2.
Can you hear me? Oh, God.
Very loud. Yeah, very clearly.
Thanks, Charles. I guess my question is probably more for Richard and Mark, but good to hear Annette's view as well. I mean, the topic about rapid evaluation to rapid change, you know, even if you do evaluate something and you plan it carefully, you're relatively clear of what the outcomes are from that and what the benefits should be. There is that key bit where you go from evaluation to change where a decision maker or multiple decision makers are involved. So I guess my question is, what do you decision makers like yourselves need to see to convince you that this evaluation should be taken to the next step to actually become part of the change? Because you'll be presented with so many different things, and some will say this is really strong or this is less strong. But you see the context in which you're trying to deliver this. Richard mentioned things like, you know, the challenges that systems face overall. So just to get your sense on, you know, that, I don't want to use the word threshold because then we're going to talk about how do you define that, but what's the key point you think where an evaluation goes from being something that's just evaluated to, okay, we should be using this to inform change now?
Okay, should we just, is there another question? If there's a pair, we'll just take those because then we can address both of them, probably.
Hi, my name's Ruth. I work in the ICB in the Southwest. Just wanted to be a little bit controversial and put the question to the room of, do you think we over-intellectualise evaluation and we need to empower others? Things like theory of change are quite straightforward. So that's one thing. And just one for Mark around, I'm working a lot on inclusion health, and NHS England's put out a framework around people experiencing the most extreme inequalities, and a lot of those people aren't in our data sets. How do you feel about that in terms of other kinds of evaluation we need to be doing those groups, or is it really about improving our existing data? Thanks.
Okay, thanks, Ruth. I think after asking a conference, a rapid evaluation conference, about whether we over-intellectualise evaluation, is you might, I'm interested to see what answer we'll get actually on that one. So a question from Devon, I think, about the kind of thresholds, particularly directed to you two, and then one about, like, are we, how much do we overthink or over-intellectualise this? And then, Mark, I think there was one on inclusion health for you. So maybe you want to go first, Mark.
I can do. I'll touch on the first one first, if that's all right.
Yep.
And then I'll go through. The convincing one, I think, is a really interesting question. So during another COVID example, so we centralised stroke services in 10 days. So we got 5 sites across East Kent, and we just put it all in Canterbury in 10 days because we were allowed to. And to answer your question, I think we had a series of clinicians in a room, and this is who were happy that it was the right thing to do. So we had a hypothesis, we centralised, we evaluated it quickly, and we proved a step change on the kind of SPC chart around mortality with a load of assumptions about clinical adjacencies that we could make. But to answer your question, I think it was around, I felt, and Richard would have a lot of these conversations, you'd have a group of clinicians and go, I think this seems like a sensible thing to do. And that leads us into awkward conversations now about, you know, where we're going to site thrombectomy and could we centralise other services and so on, because any conversation about services and where they're offered becomes political really, really quickly, you know, so we would all probably think there's probably too many hospital sites in the country. None of them are going to close particularly quickly, and more will probably open. But there's a really key strength for evaluation in kind of making that data, making that conversation less aggressive and politicised by kind of giving the evaluation data into it. So I think for us it was having a series of clinicians who were lined up going, I'm completely happy with this. Shall I wait for the others, or shall I go through and do the other?
Why don't you do the other one?
So the inclusion bit's really interesting. We're talking to a GP at the moment. We have a big traveller population in East Kent. That data is not recorded very well. It should be. There are ethnicity codes for it. People can't be bothered to say to people, can you pick your ethnicity? They just put down white other. So we've started using a technique called Origins, where we're name profiling. I did an NHSE webinar on this a couple of weeks ago where I said Eastern European doesn't equal Polish, because people assume all these young pregnant mums coming in from Eastern Europe are Polish, because 10 years ago there was a story of loads of Polish people arriving and, you know, Polish supermarkets opening. Where we live, they are now Slovak, Ukrainian, Ukrainian, and so on. And without any useful data within our PAS system or GP system, we started doing name profiling, and we did it from a good, you know, we're doing it from a good place. We're not using it to base precision-based medicine decisions. We're using it at an aggregate level to say, no, the leaflets don't need to be in Polish. It's not quite as straightforward as that. This group of mums are Albanian, these are Hungarian, these are Ukrainian, and so on. We're doing another project with the traveller community around a golden ticket idea, where they can come in whenever they want and see whoever they need to, because sending a letter telling someone to come in 8 weeks, it just doesn't work for that population. But if you call them and say, can you come in tomorrow, they are the most reliable cohort of patients. Much more reliable than any of, as a generalism, with this group. So you have to be quite creative about that, and you have to manage the IG dementors who are kind of coming at you. But you have to be kind of creative with the use of data. I 100% agree that we over-intellectualise what we're doing here as well, because that excludes a lot of people that you want to use this data in a hospital or you know, or a community trust. Thank you.
Richard, would you like to particularly answer the question about the kind of, you know, what do you need to see from evaluation to take something to the next stage?
That image of IG dementors is going to stick with me, I think. Two things. So the first bit would be a reflection on the kind of the nature of the decision-making relationship with evaluation, because where I've found it most productive, it isn't a sort of something happens, then there is an evaluation, then there is a decision, and then there is something else happening. It's has been more useful as an ongoing relationship between a team working with a service trying to change and the service trying to change. So I think some of the way we talk about it suggests there is sort of a single decision point with someone who is the decision maker. It's never that kind of that tidy in practice. But what helps? Well, right at the start of the day, there was some conversation about clarity helps and the kind of notion of, you know, the abstract, that it doesn't, it's not kind of make it simple, it's make it clear. So I kind of want to stand up a little bit for my profession and say we can cope with complicated ideas, we can cope with difficult concepts, But if you can make it clear, it's easier then to work out what the decision is in the light of those. I don't think we need to know all of the ins and outs of the methodology, but we need to know enough to know there is a methodology and it will stand enough scrutiny from colleagues and you know, if clinical colleagues are convinced, that's enormously helpful in the way Mark was describing. And I guess the last bit is kind of, and that it can be solved, because again, most of my experience of making decisions is even if I think I know what where I want to try to go, what I want to try to do, there are always other stakeholders to be brought on board, and simply landing a kind of this is right because we say it is only gets you so far. So something about how you set out the evidence in a way that convinces is perhaps the other thing I'd say is worth thinking about.
Okay, thanks, Richard. That's incredibly helpful. It almost could be a mantra for the evaluating community. And I really like the distinction between making it clear rather than simple, because I don't think we want to be dumbing stuff down, because as you say, you're used to dealing with complexity and uncertainty. And also I like that, you know, do you have confidence in it and can you sell it? I think that's really, really good. And is there anything you want to talk about? Which I'm not quite sure what over-intellectualizing quite means, but what do you think the pitfalls sometimes that evaluators might fall into the kind of like getting too much into the intellectual space might be?
We love our methods, and I think it's not as bad now, but I used to go to conferences and people would run out of time before they got to the end of describing the methods, which is limiting for the audience. I mean, so I do think we overcomplicate things. I think one of the big contributions that people with lived experiences have made to research and evaluation is that they've helped call that out, you know, call out the way that we communicate with each other and what we write down. I'm on the steering group for an NIHR project called Spinning the Plates, which is around for parents of and carers of people with young people with complex conditions. And all the materials are done for everybody who participates in the program. And we're talking about sharing the findings from the work they've been doing. And we're saying, well, just use the stuff you've done for people with lived experience, because it's clear, it's presented in a way that you can get through it very quickly. It's more engaging and colourful. You know, why shouldn't everybody? It's not that it's not complicated, because the messages are very complicated from this piece of work, but it's just communicated in a way that's accessible. So I think we've made a lot of progress in that direction. I would just say on the point you were raising around data and kind of different communities and how that, I think one of the real improvements that's happened in the kind of research, evaluation, knowledge kind of debates is a recognition that data and evaluation are inherently political, what we decide to measure, how we measure it, how well we measure it, how we store it, how we make it accessible. And so this has particularly been driven by Indigenous communities in Australia and Canada, from ethnic minority communities in America, sort of saying we are pushed out of the picture. There's no data about how we experience these conditions. Our knowledge doesn't count. And so I think there's been a real revisiting of what we count as evidence and also what we measure, and to be really kind of cognizant of that when we're doing, we don't not have the data because people have been withholding it. Sometimes we haven't been asking, or we haven't been making the kind of effort that Mark was describing to find out what we need to deliver services well.
Thank you very much. More questions from the floor. One over here and one over here, I think. There's another one coming from over here, I think.
Hello.
Oh,
Here I
that's
am.
good.
Oh, good. I've gained a voice. That's a patient joke. Sorry. I was interested to hear from each perspective of our panellists. You know, so Keir Starmer is standing in front of you, and he says, "Right, guys, this may come true. I know I have mental health problems. I know it's a delusion, but." He becomes the next Prime Minister of the country, and we have a new regime And he says, okay guys, what are the 3 things that I need to do to improve health and social care in the country? Over to you.
Okay, we'll hold that question just for a minute. And there's a question over here.
Hi, hello, I'm Raj Mehta and I'm a public contributor on Reset. My question is really, can you help me understand how evaluation team or evaluators pass on to the implementation team knowledge that's not on that paper that they're actually published? And if you have to take some actions, how would you actually go about getting that knowledge so it is most efficiently done?
Sorry, so this was, sorry, just to clarify the question, so that was about how do you get the knowledge about?
Yeah, it's knowledge that you've captured when you're doing the evaluation.
Okay.
And that knowledge which is not on paper, because a lot of that conversation, discussion, relationship that you built with the people that you've interviewed, etc., will be in your head. And how does that get across to the implementation team?
Okay, that's a brilliant question, I think. So it's partly about the sort of tacit knowledge that people have and how because that often is some of the most important knowledge, really. It's hard to write down sometimes, but very, very crucial. So I think that's actually quite a nice pair of questions. So what would you say to Keir Starmer? Or indeed,
in the sense that it
it
reminded me of like the most difficult question I've ever faced at a conference. I presented to a local LMC about linking all their data for all these good evaluation purposes and research and everything, and I thought the presentation had gone quite well. And I sat down with my public health colleague thinking this will be good, and then they asked the audience for some questions, and someone at the back said, "Is this the beginning of an Orwellian nightmare?" And that was the first question. So as you answered, I was thinking, I've got nothing to say. The only thing I would say is I still don't feel as though the incentives around commissioning are lined up, and I don't want another reorganisation, but I would want a more incentivised set of commissioning decisions to be made. So, I work in an acute hospital, which works in the community. We would potentially argue about, well, this patient's ready, why don't you take, well, I don't want that, well, they're not quite up for us, and so on. And then you've kind of got social care and so on. It doesn't feel, and we talk about it, but it still doesn't feel like those incentives are quite lined up. So I think don't reorganise it again, whether they're CCGs or ICBs or STPs, I don't really care. The hospital's the hospital because someone will come off a motorbike tonight, so figure out the other stuff, and for me that's aligning incentives around commissioning, I think.
Okay, you two, interested in your views. We might want to answer Sir Keir Starmer in an evaluation way. He might say, I'm going to be wanting to do these 3 big programmes. What role should evaluation play? We might want to answer that question instead. Of course.
We might. So I think I would try and say 2 things to whoever the next Prime Minister is as a kind of good public servant. I'll avoid a kind of party political answer. And part of us builds a bit on Mark's point. I think the key to the next phase lies in kind of integrated health and care in the neighbourhoods. I think it's that public health preventative model, because the NHS can continue to try and make people well again as much as people are willing to pay us to do. But unless we put our shoulder to the wheel with wider government on helping people stay well, eventually we will run out of money to keep putting people well again. The evaluation bit is, I suspect it isn't one great big policy change that makes that happen. I suspect it's a whole series of different things from different parts of the NHS and government and social care and maybe building in a let's try something, let's evaluate it, let's learn from that, let's adapt it, let's try something else model may help us get there faster than somebody trying to develop a single policy that solves the problem.
Annette?
Again, I'm going to go political. So be brave enough to look at the funding of long-term care. It'd be nice. I think for the evaluation one for me would be how we, and this is really how we can help with what we understand about the policy levers and mechanisms that we've already done lots of evaluation about. Because the new government will always be wanting to put their own mark on things, but the sort of generic ways of doing things and the learning we have already, how can we mobilise that to be useful? And in higher education, how do we incentivise universities, and as a number of people have mentioned, to make this kind of work well rewarded, really, so that people want to be evaluators, want to engage with policy, practice, be part of these local collaborations, and it's not stuff that people have described to us as things they do on the side and at the weekend, but more central to their academic roles.
Okay, that's really nice, thank you. And the other question we had, which was around the, my paraphrasing of it, the kind of capturing, how do we capture and transmit the sort of tacit knowledge from evaluators to implementers?
Yes, I heard something slightly different, and maybe that's because I'm struggling with this at the moment, which is, I'm writing an evaluation report. It's been a little bit of a tricky project. It's quite difficult relationships, a bit of a disaster in terms of outcomes. So we're not recording this, are we? One of me. So say, and it's all going very well. So this is back to your point. So then you write the evaluation report, you capture as much of that as you can. But what about that other learning, the learning that you'd want to speak to and have a dialogue around? And I think if you've got the relationships and the trust there, you can have those conversations. They're a difficult conversation. We've already talked about difficult conversations in this work. But if that was a bit more explicitly part of the work that we did, and we had a bit more training and support to do it, I think that how you actually communicate some of those things about if you were going to do this again, what you did differently, how we deal sensitively with the kind of work that people have put into things that haven't worked very well and that they have a lot of ownership of, and that if seeing that as part of our role, that would absolutely be in dialogue and would never be in the final report.
Yeah.
So I think it is about the work we do around the kind of formal documented part of an evaluation that does sometimes get smoothed out in the kind of published narrative, but it doesn't mean it should get lost because it's probably the most important bit.
Yeah, okay. So I concede that interpretation of the question, which I think you're absolutely right on. We see it all the time, don't we?
Yeah.
Where the evaluation report, if you're kind of used to this, you can read between the lines, but it does take quite a lot sometimes of doing that, and it's not as clear as having the conversation with someone.
No, definitely.
Yeah. Any other reflections? Mark, you've probably experienced this kind of thing.
Yeah, selfishly, I've interpreted that in a slightly different way to make a technical point. And I think from the Goldacre review that came out around the work that we do, that the message I took from Ben Goldacre was that you as an evaluator or an analyst or whoever, you have to proactively share your learning. And we definitely don't do that at any sort of scale. And there's lots of little projects coming, like use of things like open source and GitHub and reproducible analytical pipelines and so on. But I still think it works for that question. I think the thing I'm trying to get to my team and the sort of team across Kent and Medway is we have to proactively share everything that we've learned. So not keep some back, not leave some for interpretation, not do an analysis in a certain way that someone couldn't recreate because we've done it in a kind of black box way, but to be really open in your evaluation about your methods, how you've done the data, all of that. And I still don't feel like that still feels relatively new, doesn't it, I think? That kind of model of you have to proactively share what you do. There's still this, and it's back to the sort of being flippant about the sort of academic, you're set up in such a way that you have to almost create IP each time, and you feel like you're competing sometimes for funding, publication, and so on, which, it doesn't sound positive. So what can we do so that people are more, sharing more the whole time, I think?
Richard, did you have anything you want to say about this, just in terms of there's a programme perhaps that you've commissioned for an evaluation of. How do you get the kind of the stuff which isn't the evaluation report?
Yeah. Well, I guess there's as much of it as possible in the report is obviously the most helpful arrangement. And I did once receive a report that had a fair amount of written in code about it, and I read it and said back to the team who'd done the work, so I think you're telling me this, and their jaws dropped, and they said, no, we're telling you quite the opposite. We've just told you it really carefully. I said, well, then you've kind of rather over-coded, haven't you? So we need to be careful about that. For me, it comes back to the nature of the relationship with the team doing the evaluation. If it's the kind of relationship that outlasts a particular project, it is easier to do the kind of end of, what we also learned was, this is how we felt about this, here are some things we think we could share. But I would also echo Mark's point about the more public we make all of it, the better, as much as is possible within the constraints we're all working within.
Yeah, okay, thanks. Yeah, and I think, as you said, the relationship is key here, because lots of that coding comes from, we don't want to upset anything. And actually, but I think having a more mature response to evaluations and thinking if you take the view that it's about learning, then, actually, I think having it, more of it in the report is better, something to aim for, but it's never going to be the entirety of it.
And if I might, I think, because from where I sit, where evaluation is more about, we're trying to run services in this way, how do we best do it? You're not talking about a stop-go decision as a consequence of an evaluation. You're talking about a change what we're doing decision in the light of it. That might be different in other places where it's, will policy X continue, yes or no, but that's often not my experience.
Okay, thank you. Any other questions? Excellent. Couple of hands towards the back. Paul, is that your hand I can see?
Thank you. Paul Mason, I'm Head of Evaluation at the Strategy Unit. Mine follows on, I think, from the last question, which I'm afraid I missed because I was using the facilities, but I heard the answers. And it was making me think, as someone who spends my life doing evaluations mostly for NHS England, Mark made a reference earlier to, reports or findings going to future NHS, which is where I think information goes to die. Should the NHS publish all of the reports that it pays for? And how can we persuade NHS England in particular to make the reports it pays for available so that the learning is widely available and doesn't get sat on or put on future NHS in the vague hope that someone's going to open their weekly email alert and find it and read it.
Thanks, Paul. Was there another question? Yeah.
The focus seems to be, which makes a lot of sense, that there's a heavy emphasis on kind of the relationship, the kind of stakeholder building, but the language surrounding that is sort of this reactive or reflective to the needs and desires of commissioning bodies or those stakeholders. How, as a evaluation community, can we be more able in our practice to actually leverage what power we do have in this dynamic to actually not have to rely necessarily on only going for commissioning bodies that are open or projects that have that potentiality, but rather crafting that space and time actually in the evaluation itself?
Okay, thank you very much. So a couple of questions there. Who would like to go first? Mark?
I'm happy to. I'll take the first one first. We started a charity which the Health Foundation put some money into, which is great, called Open Data Saves Lives, and we just published everything on the internet. So I agree with what you're kind of alluding to. Why wouldn't you just publish more widely and aggressively? I still think, unfortunately, we're in an era where you find one trust that's done something really well. You might find it by coincidence because you've been to a conference and think, oh my God, I was just about to start that, and they've already cracked it, or they've done a really interesting piece of work. It still doesn't feel easy to find, whether it's NICE doing it or NHS England or whomever. So just publish it all and proactively, aggressively publish it would be my view. Do you want me to answer the second one while I'm talking?
Yep.
The second one, I'll just answer in a kind of quite informal way. So the relationships that we've created locally have been simply by just going and talking to people. And, you know, I know that we run master's programs at the university, so I find out when they're meeting and the module that they're talking about, and I stand up and say, you should come and work in the NHS. It's great. You've got a pretty good pension, you've got flexible working, you're always going to have more demand than you will ever need. You know, my best friend from school went and took a really highly paid job in a record company. Well, that industry's died on its arse, you know, and he's a plasterer now, which is fantastic, but it's not what he thought he was doing, you know, he was going to be doing. There will always be more customers than we'll ever need. So if you come out of the private sector where you're constantly trying to find new customers, come work in the NHS, because there'll always be too many of them. So the thing that works quite well with universities, I'm now running 3 or 4 master's students from 3 or 4 universities, just running them through. I can put academics on NHSP contracts, we can find bits of funding. You don't have to do everything through these very traditional straight routes. There's absolutely a role for, you know, things like NIHR and so, but I would literally just go and have a coffee and you'll find the person and you'll find a little bit of money, or you'll get the ear of the chief exec. Just be much more creative. Don't look for the traditional way of doing these things all the time, would be my view. Because we've had to do that the other way. You know, I've just gone and banged on doors in universities until I've found the person that's running the course that is interesting to me to recruit people from. But that's just legwork, but it's really simple, informal stuff.
Thanks, Mark. Annette, I'm going to go to you next, just to
Just
mix
quite
up the order.
blinded by the scary image of you running around universities knocking on people's doors.
Literally.
At least I know no one's ever there, so it's all right. I think it's a really important point about resetting the power, and I hope that I feel there's a lot of promise in the kind of more partnership-based work that's being funded at the moment for people doing evaluation, people doing policy and practice work to be part of more equal partnerships where we are having these conversations. I know a colleague who runs the Policy and Innovation Research Unit up at London School of Hygiene, and he said, you know, he often sits down and the policy team at Department of Health and Social Care say, we want to do this, and he can say, don't do that. We've done that for you before. You know, that's the dialogue, and it's having that dialogue right at the start, as someone mentioned earlier. With regard to publishing stuff, I mean, I absolutely think that is critical. I'm actually a bit surprised that it's not happening and things aren't accessible. And we did a bit of work with NIHR about what it had in its portfolio to help other government departments answer its health-related questions. So Ministry of Justice and the Home Office around kind of the health of prisoners, schools around mental health of young people, transport around kind of the environmental health. None of those departments had money to spend on research. We have in health and increasingly social care money to spend on research, and that research, other departments are crying out to have kind of access to that. So I think we have a responsibility to share that money that public has invested in with all the kind of potential people who might use it. So yeah, I absolutely think that's really important.
Yeah, and maybe that's one of the things we could say to Sir Keir Starmer, which is NHS England should publish the evaluations that it commissions. I mean, that would be quite a simple thing, I think, and I think there are, across government, I think there is now, isn't there a repository of like published evaluations? Isn't there a commitment that all of that will be published? I think it's actually Whitehall's probably further ahead than the NHS in that respect. Richard.
Thank you. I mean, my answer to the publication question would be, I mean, in principle, why wouldn't we want as much of the properly done work that's available to be available as widely as possible? I guess in a kind of political system, NHS England have to wrestle with some constraints that are above my pay grade in that regard. But the kind of principle for me would be kind of the more open we are about the work that's being done, the better for everybody. I mean, on the kind of the sort of leveraging the sort of power of the rapid evaluation community question, if that's the way, I mean, I agree with what Annette and Mark have said, but there's maybe also something about kind of setting out for those of us who might be using the evaluation what a properly robust evaluation must look like, what it must do, and a bit of that shared, folks in the space coming together and saying, if it doesn't have these 5 characteristics, then you shouldn't be looking at it. I mean, some of the things we've been talking about today and that exist in the literature and that are part of the conversation the community has with itself. But only really struck me when I put a relatively small toe in the water via Brace, saying if you're thinking about an evaluation and you want to spend money on it, you shouldn't spend money on it unless. Yeah. And there could be some initiative that you know, folks in this room could take in that regard, I think.
Yeah, okay. That's a really, really nice place to end, actually. And it did make me think, actually, that last question about the resetting relationship, this power, something which I was sort of reflecting on right at the beginning, and I was thinking about asking it, which was, it comes back to the whole of this rapid evaluation. You know, what I hear, and actually I've been a great proponent of rapid evaluation for as long as I've worked in it, but what I hear sometimes is evaluators are bending over backwards to meet what might sometimes be slightly unreasonable demands, and that sometimes actually having a bit of space between something happening and a decision being made might be good, and encouraging people in the system to create a bit more space between that might be not a bad thing, because I do think sometimes the pace of decision making is too quick, and when you look back at the whole stream of things, you know, which decisions are made quickly and they just haven't worked, you know, or 10 years later they just like didn't work. You know, perhaps there could be some value in us as evaluators pushing back a bit more, and that, not just on the timing, but also the approach. So setting up a program which is evaluable, because some programs are just not set up. I think someone was reminding me the other day of this very first conference here. There was a big discussion, the whole stream about rapid cycle evaluation. This idea of, you know, doing small cycles, having a change, doing a rapid evaluation of that, feeding the results back. You know, so many programs could be set up like that, but actually aren't set up in that way. So I do think the role we play in helping programs themselves be designed well, including when decisions are making, is very important for us. So on that note, I just want to end this session. Thank you very, very much to our excellent panelists. If you can all join me in a round of applause.